Every week, every day, every hour that passes by, the world of healthcare transforms. New treatments for new patients with new experiences, new technology, new staff, outside the hospital, inside. Some consider transformation as their responsibility, their obligation. We call them agents of change, our RQI pioneers.
It's been an awakening in terms of CPR quality and resuscitation quality.
We were able to really get buy-in from everyone across the organization.
More resuscitation events are successful, more patients survive, more patients ultimately go home.
We were looking for that next evolution of education for our staff that would keep them at the bedside.
The old training with ACLS every 2 to 3 years is archaic.
As a magnet hospital, we're innovative, we're creative, and we really love cutting-edge technology.
In early 2014, Texas Health Resources Presbyterian Dallas enrolled 2,100 healthcare providers in the RQI program.
Texas Health Resources chose to implement the RQI program because it was a natural match with our mission, our vision, and our values. It really reflected what we were trying to do in the community, which is to improve the lives of the people that we serve in the communities that we care for them in.
We've seen statistically significant improvements in survival rates from cardiac arrest at our organization since implementing the RQI program.
We were a very traditional model, which meant a lot of time away from the bedside, a lot of time in the classrooms, and a lot of expense on salaries and wages. What we found by implementing the RQI system is that we will save over $300,000 this year in terms of what we would have spent traditionally on the old model.
The program has expanded system-wide at THR with currently over 12,000 employees engaged in low-dose, high-frequency quality improvement. The Ohio State University Wexner Medical Center was the original RQI pilot site and the first RQI adoption anywhere in the world. As an academic medical center, Ohio State took a data-verified approach to quality improvement.
As we started looking at some of our data and looking at the initial attempts with the RQI equipment, the realization that even as seasoned professionals, we got a lot of room to improve. We've got a lot of room to grow. I've been a paramedic for almost 20 years now, and the first time I got on an RQI cart, it was really mind-blowing how much room I had for improvement. I'd say I did great CPR. I can tell you now I do it even better. The low-dose, high-frequency model that's utilized there is very similar to what we see in, say, a music lesson. Whether you're a professional piano player playing multiple concerts a year, or you're an amateur that may only play one concert a year, you practice. You spend time preparing for that. And with RQI, we get that same concept with resuscitation.
UAB is the only Level 1 adult trauma center hospital in Alabama. UAB Medicine's emergency physicians are on the forefront of modern medical care, and UAB nurses are honored as Alabama's only magnet hospital.
Like any disruptive technology, we were very concerned when we introduced RQI that there would be some resistance or some hesitation. What we found is that the uptake of the new RQI platform was actually very rapid, and the staff was very accepting. My staff now competes to determine who gets the best proficiency to see who can score higher. That is the intangible gold that I can't buy, I can't institute, I can't create through some other means. When you make a change, what you want to be able to see is that you're getting a return on your investment. It doesn't matter if you want to measure it by the dollars saved. It doesn't matter if you want to measure it by the intangible change in culture and the confidence the staff has. It doesn't matter if you want to measure it by lives saved after resuscitation events in your hospital. Any way you measure it, RQI clearly represents a fundamental change in the way we practice resuscitation, and that is a clear improvement over the paradigm that we're using now.
As a research organization dedicated to continuous improvement, the University of Rochester initiated their RQI program as a pilot to study the efficiency of the program with their clinical workforce.
The University of Rochester's mantra is Meliora, which means ever better. And so RQI was for us just that, something that brought to the forefront not only a better educational model, better delivery system for CPR, but we've seen enhanced quality patient outcomes with it.
When we implemented RQI, we didn't just do it for the nursing staff and the adult critical care areas. We were able to really collaborate with our residency program, with our fellows, with our attendings. It also included respiratory care, really anyone who could participate in a code.
I was so impressed by the program and the quality improvement it provided to our patients that I added RQI to the list of quality improvement processes that faculty could partake in that would result in a 15% malpractice reduction for them.
We are indebted to these pioneer leaders who have lit the path and blazed the trail for a new reality in resuscitation. In doing so, they have made the world a safer place, one hospital, one community at a time.